This is going to be a series of videos on demystifying your healthcare billing. Kind of feels a little overwhelming, right? Yep, for me too. So these are questions I get all the time, very, very common questions from clients and also potential clients. And so what we're going to do is keep it really simple and do one idea at a time. In this video, we're going to talk about explanation of benefit statements, or EOBs, and how to review them. And so with EOBs, what an EOB is actually something that's produced by your insurance company to protect you and kind of give you the idea and the information about how your insurance was allocated when a claim was filed by a doctor or a hospital, okay? And so it'll say on the EOB, it'll say what the provider actually charged, so the amount that was charged to the provider. It'll show what the network discount was, if any. If you have a PPO, there's typically gonna be a network discount on there as well. And all that's gonna bring down the cost. And so besides the network discount, you're also gonna get if an insurance benefit was paid, like a certain dollar amount that was paid toward it. And then you'll also see if there's any amount at the end that you may owe. And that's not a bill. A lot of people think it is, but it's actually the insurance company telling you, this is the amount you may owe based on our records and how your insurance was allocated. Now, the bill that you get from the provider, it should match that amount if there's anything that they're saying that you owe. This comes up a lot when a client of mine receives a bill from, let's say they got hospitalized. And this happens a lot with hospital visits because there's lots of different providers sometimes that will treat someone while they're inpatient in a hospital, or even if they're there just for a day. And it gets a little bit confusing. And so if you get bills from a provider and you think, hey, I thought this was covered, I thought I had only a deductible of blank, but they're saying that I owe this, you don't pay anything until you receive your explanation of benefits statement, EOB, from the insurance company. The EOB is gonna give you like the whole back picture of what it is that you owe and why, and that's another way to see if the insurance company made a mistake or if the provider made a mistake. Mistakes happen a lot. I catch them all the time, and so having that EOB is really gonna give you the information you need to ask your agent if they can help you with figuring out if there was a mistake or not, because you wanna make sure if you have to pay something that it is actually amount that's correct that you owe on the insurance, and that it wasn't something that was just billed incorrectly. So not all agents will do this and will help their clients with their EOBs and understanding. I take an approach that if I'm able to take some time with my clients and help them on these specific areas, that as I'm doing that, I'm also teaching them and empowering them on how they can do this themselves for their families. And it works all the time. Like, once I teach you, you know how to do this, and then you'll be able to tell me if something's wrong. And so if you don't have an agent that'll do that with you and you're curious about getting into something a little bit different and getting a little bit more personalized help, reach out to me. I would love to help you and your family. You can find me at alexthehealthagent.com, or you can follow me on Instagram, and I've got lots of videos like this that'll help you and give you information for free. And also my services are free, so the insurance companies pay me, so you don't have to. And I like to take this approach with my clients. I find that it works really well. I have happy clients that are empowered, and it's a win-win. If you found this video helpful, please share it and comment, like, and subscribe. And I would love to connect with you.